8 p.m. last night, there were 1,281 cases of community transmission in New South Wales, and regrettably 5 people lost their lives, and we extend our deepest condolences to their loved ones. Late last week, I received modelling on when our health experts think the peak will hit in terms of the number of cases, what the ICU requirements might be, and what the number of people in hospital might be. And I'm pleased to say that today we'll be making all of that public, but I do want to qualify all of that to say that modelling depends on a number of things, a number of variables. And if too many of us do the wrong thing and there are too many super spreading events, we could see those numbers not be what they are. But I do want to stress the following, that today Dr. Champ will outline that we have 177 patients in our intensive care units with COVID. At any given time in our hospital system, there'd be around 400 people with non-COVID related issues in ICU. And so our surge capacity, including staff, in our intensive care units is 1,550. So just to give people that reassurance, we certainly don't want to have to use all those beds and that staff, because we know what a pressure it will put on the system. But I want everybody to be reassured that the capacity is there, and according to the modelling that I've received, we're likely to reach a peak in cases in the next week or so. That's what the modelling tells us, and therefore a likely peak in intensive care beds required around early to mid-October. So that's what the best modelling tells us at this stage, but I do want to qualify that by saying that a number of variables are associated with that modelling. What this model does is give people a medium and long-term look at what the next few months will be like. It's not just a week-by-week look, but it's what the next few months are likely to look like.
Obviously, though, using that national rate of 5.5% was misleading to the public, because it's in fact 11%.
Not at all.
The week before it was 12%.
Not at all. We have been so transparent every day. We give you excuse me, hold on, can I answer this question? Every day we stand here and tell you the number of people in ICU, the number of people in hospital, the number of people with COVID. We are so transparent with our information, and this modelling, I doubt any state's been able to provide this level of detail in their own modelling, and we will be at the forefront of that.